Welcome back to my YouTube channel. In today's video, we'll be looking at the medial compartment of the thigh, also known as the adductor compartment. So within this adductor compartment, there are a group of muscles that are found within this compartment. Firstly, we are going to look at this muscle here called the pectineus muscle. So this pectineus muscle here originates from the pectinate line of the pubic bone, and it also inserts on the pectinate line of the femur. We have another muscle again that we cannot really appreciate because it lies more deeper. That muscle is called the obturator externus muscle. Okay. After then, we now see this muscle here that plays a role in forming the femoral triangle, which is the adductor longus. Okay. So this adductor longus here, it originates from the superior ramus of the pubic, and it now inserts on the it also inserts in the medial lip of the linea aspera on the shaft of the femur. Okay, so we have another muscle again behind this adductor longus. We have another muscle here. So this one is called the adductor brevis. Okay, so this adductor brevis, it originates from the inferior ramus of the pubic and also inserts on the shaft, mainly the medial lip of the linea aspera of the shaft of the femur. Then lastly, we have this one here. This one is called the adductor magnus. Okay, but one interesting thing about this adductor magnus is that it is divided into the abductor compartment, the one that is very close to the abductor group, and there is another one here that is very close to the hamstring groups. Okay, so two of them fuse together, so it originates. So the adductor group originates from the inferior ramus, while the one of the hamstring groups originate from the ischia tuberosity. So they fuse together, and then some part of the adductor group inserts on the linea aspera, which is found on the shaft of the femur, and while some parts form a kind of tendon-like structure that insert on the adductor tubercle found on the medial condyle of the femur. Okay, so these groups of muscle here are being supplied by this nerve here. This is called the obturator nerve. Okay, so we have anterior groups of obturator nerve and the posterior groups. Okay, so these are the anterior groups that supplies this next muscle. So we have this next muscle here, which is called the gracilis muscle. So this gracilis muscle originates somewhere within the pubic symphysis, and then it's now inserts down on the lateral medial condyle of the tibia, overlying the medial condyle of the femur. Okay, so like I said, they're both being supplied by the obturator nerves. So these are the groups of obturator nerves. So these obturator nerves, they originate from the anterior cord of the lumbosacral plexus, L2 to L4 lumbosacral plexus. So they both supply the medial compartment of the thigh. Okay, so we are going to look at the abductor canal and what forms the boundaries of the abductor canal. Okay, so let's talk about the abductor canal, also known as the Hunter's canal or the subsartorius canal. Okay, so this is the subsartorius canal or the abductor canal. It's a passageway in which neurovascular structures like these nerves here, passes through from the anterior compartment to the posterior compartment of the thigh. Okay, and it is bounded anteriorly by this muscle here called the sartorius muscle, which lies anterior to it, and then posteriorly you can see this muscle here. This is the abductor compartment of the adductor magnus. Okay, so the content that passes within this canal firstly is this artery here, which is called the femoral arteries, and then we have the femoral vein, and then we have another long nerve that passes within that canal as well. So this is the nerve here. This nerve is called the saphenous nerve. Okay, so they pass within this canal. Like we said, that this canal is about 15 cm long. So from this apex, where the junction between the adductor longus and the sartorius muscle meets, so this area is called the apex of the femoral triangle. That is where this abductor canal continues down to where they exited to enter into the popliteal fossa. Okay, so within this area they entered into the popliteal fossa, we have what we call the adductor hiatus. Okay, so this adductor hiatus, when we flip this muscle, okay, we now see the abductor hiatus. So this opening here is called the adductor hiatus, where this neurovascular structure, the arteries and vein and the nerves bypasses and enter into the popliteal fossa. This opening is called the adductor hiatus. Now, there are boundaries of this adductor hiatus. So we have the boundaries like posteriorly, we have the boundaries like superiorly, posterior, superior. We have this muscle here, which is the adductor magnus, and then we have posterior distally or posterior distally. We have these two muscles here, which is the semimembranosus and semitendinosus. So they form this hiatus posterior inferiorly. Okay, then medially we have this muscle here called the gracilis and the tendon coming from the adductor magnus. So these two tendons here forms the boundaries medially. So laterally we have this muscle, the bone here, which is the femur, distal part of the femur, and anteriorly we have two muscles that forms the anterior border of this adductor hiatus. We have the vastus medialis and the sartorius muscles. Okay, this is what we have to say in the adductor compartment, the adductor canal, and adductor hiatus. Thank you very much. See you next.